Great, let's get started. My name is Ian Gomez and I'm part of the marketing team at H2O. We're very excited to be hosting this community discussion on AI in healthcare. Leading the discussion will be Sri Ambati, CEO and founder of H2O. Please be sure to ask your questions in your console. This discussion will be recorded and will be made available in the next day. With that said, I'll hand it over to Sri.
Thank you for taking the time. It's a privilege to be here. And it's a privilege to be of service to the world in its hour of need. H2AI is, as you know, was founded with a core theme towards democratizing AI, and specifically in reaction to inequities in healthcare. And so I think democratization of health is a natural progression for open source and for H2O. So we're quite excited to use COVID-19 as a way to spur that intentions and spur more of that investment into health. During COVID-19 pandemic, our world, our nation and states and counties and cities face an unprecedented challenge with an urgent need to help our citizens and ultimately our national and global economies. At risk are the senior citizens, at-risk populations, individuals with comorbidities, and our critical frontline healthcare workforce, who are the true heroes fighting this war. The need of the hour is for all of us to come together and to bring the world's finest technology and AI in our fight against the virus. Our goal is to bring the latest developments in data, artificial intelligence, machine learning, our Kaggle grandmasters and data scientists worldwide, domain scientists worldwide, healthcare practitioners to band together and create a one force that can go against an interspecies war. Our aim is to help facilities today as they are facing the surge. Our heart goes out to China, which took the first brunt of the war. Our heart goes out to Italy, to New York, Iran, and every other place which is fighting this. They're alone socially, but at the same time connected globally. We are in this together. Our partners and communities like Kaiser Permanente, Aetna, Hospital Corporation of America, Roche, Allergan, Genentech, Merck, United Health Group, and several others are coming together, coming forth to help us, guide us, how we can help them. And today is the jumpstart of what hopefully will be a unified movement to bring most of our data scientists and health scientists to transform healthcare as we know it, to make it open, to make it borderless, to make it really meaningful, saving lives through remote healthcare, as well as much more equitable testing and bringing healthcare where it's really needed by democratizing it, by making it as simple as a diagnostic in every home and as simple as visiting the old way of doing health, where it's less about care and more about health. And our core themes are all coming together, and we're so excited to jumpstart that with a community webinar / meetup that we are going to make very data-driven and very much sharing what we know about what's going on and make this a long-term investment on our part. I want to jumpstart and let the team introduce themselves. Niki.
Thank you, Sri. Hi, my name is Niki Athanasiadou. I am a data scientist at H2O, working very closely with healthcare companies. My background is on a lot of things touching upon healthcare, actually, from genomics and personalized medicine. I have worked for 12 years in research in various universities in these fields, as well as population health and all models for population health, as well as social determinants of health research. Thank you, Sri.
David.
Sure. So I come with healthcare is one of my passions. Actually, it's probably my primary passion. So I've had about 15 years of experience, both on the clinical side and on the operations side. So I had about a decade worth of experience in biomedical research, working with Massachusetts General Hospital. And more recently, I've worked on the operations side. So I helped build out the analytics team for healthcare strategy for the University of Utah hospitals and clinics. It's just a fascinating time to be involved in data science.
Thank you. Welcome, Marius.
Hi, everyone. I'm Marius. I'm not a health professional like the rest of my colleagues. I've done a PhD in machine learning. I've worked as data scientist at H2O, specifically with our products, and work very closely with many of our customers, some of which are in the healthcare space. I'm very sensitive towards this pandemic, and I want to use the data science skills that I have acquired, for example, through Kaggle and other projects I work with. I used to be ranked #1 on Kaggle, in order to be able to make a valid contribution.
Welcome. So I want to jumpstart or kick off with some of the work that we've been get started with COVID-19 specific use cases. Especially, we were trying to answer a question: how many hospital beds, how many ventilators, and how many ICU beds will be needed in a very immediate surge-like situation? And we banded together our stack of applications. And so you're looking at Q here. Just start with and then have Marius kind of explain the science behind, so that we can all get a feel for what kind of modeling and simulation we've been looking at.
Sure. I think a lot of people at this point are struggling with the fact that there is not that much available data. And even if there is data, maybe it's not at best quality possible, which is actually the case with many other projects. So I think simulation can be a very powerful tool in being able to understand, combine data science elements, but at the same time help you understand how things are going to pan out. And we could use machine learning in order to make a forecast about how many beds we're going to need. We can use public information to estimate forecasts, to make forecasts of new coronavirus cases in different geographical areas or in different states in the US. We can obtain information about the overall characteristics that people have in terms of demographics, age, distribution of diseases that may have. We can find admission rates to hospitals on a daily basis. We can find how many hospitals there are available in different countries or in different states, and then use the forecast we make in order to estimate how quickly we're going to reach the maximum capacity.
So tell me about the data sets here. Are some of these the number of beds, somewhat so they're realistic data sets? Demographics, what kind of data sets did you borrow these from?
Correct. I mean, the main source of the information, and you can see the screen, the first component is the forecast of the new coronavirus cases. And for this, we've used the Johns Hopkins data that the university is providing. We should highlight it's not perfect, but it's a good basis to understand on a general level of how things are going to pan out. So that's one element. There are a few published reports about how many hospitals they are available in the US in different states, how many beds are available, how many ICU units, and what's the current maximum capacity. I will provide links about these sources later on. There are papers and published reports about the overall distribution of age of people that have been committed to that have been admitted to US hospitals. We can obtain information from AACD about proportion of different diseases that people were affected with, and how many days they stayed in hospital on average. So we can compile all this information to produce the simulation.
So I noticed that the other day you had the ICU crossover line much earlier to where it is today. Are you seeing a slightly improvement?
No, I just made an adjustment on the ICU units available beds. I'm using two information which they don't publish the same numbers, so I decided to take actually the highest of the two. That's why it looks a little bit different here, because I'm optimistic.
You know, I think it's important to point out here that what's been done is really significant, right? Because we hear a lot from people, and we ourselves have faced this problem where you hear that, oh, there's not a lot of good data available, or the data are incomplete. But this is not an uncommon problem in healthcare. And I think it's important. I mean, what's been done here is take as many different data sources as possible and bring them together to provide a fuller picture. I think that's going to be the solution for anyone involved in this work.
Yeah, that's a very good point too.
I think one of the things that, as we kept talking to different hospitals and different community health systems here in the US, one of the things we found was that all of them were trying to answer the same questions. Different county level modeling was happening, but I think there was kind of a paralysis around, I don't have the data, or I don't want to even play with potential arrival rates of different comorbidities or potential arrival rates of different demographics. So one of the things that we got the team to put together is to bring a lot of some assumptions and look at traditional demographics now, and then apply them and see what the simulation would lead to. I can say that at least from the UCSF data, we are seeing that some of the flatlining here for California seems to be somewhat on par with what we are seeing realistically. Michigan, of course, has been on a rise, and a lot of folks are moving out of densely populated cities to sparsely populated cities. We're beginning to look at new kind of data sets that are coming to the fore, which are trying to talk about how long social distancing should be, and kind of even actually mobile non-PID mobile data to start seeing if there are new places of infection that are on the rise from people leaving from the cities.
Something I would like to address here is that there is no perfect data in the world. Obviously, what puts higher intensity here on getting the right data is the fact that it is a very sensitive problem, right? You can make mistakes here and it affects people's lives. But on the other hand, we also, we need to be able to help. I mean, there is still valuable information in this data. We need to make certain we have good cleaning procedures, and we can still produce valuable insights
with folks joining
from the data that's currently available.
There are folks joining from India. There's a few of them. SRK is working on the India data sets and dashboards. So there's a GitHub project, H2O AI COVID data sets, that you could essentially point to. We'll put some links up towards the tail end. We're modeling for not just the US. I think we're beginning to learn how to model these and get ahead of the curve, so we can start helping, in general, folks that are in the most need. But I think these are good starting points. I would call a very large portion of H2O team. All the grandmasters are on alert to be helpful to our customers, our community at this time in any science work that is that's needed. It's not this is not a commercial outreach for us. We want to build community, build the grassroots, And health sciences need as much openness and open source. And this is a massive opportunity to transform a vertical that can become really life-giving to a lot of us. I want to divert a little of these to kind of a Q&A where, Niki, how did you get into this space, and how has the ongoing pandemic, I mean, you've studied this for years, how did this, where did you get started, and why are you here?
Yes, so I guess where I got started is I have always been interested in complex systems. So I thought nothing is more complex than biological molecular systems. That was my drive for joining this big adventure. Starting from there.
The whole pandemic is a complex system failure, isn't it?
Well, I can see some positive aspects, because we have been talking a lot about the lag in digital transformation in the healthcare field. So I think what we're experiencing with this pandemic actually is good news, because we're now in this cusp in time where we do have, as David mentioned earlier, we do start to have more organized, centrally organized, or from volunteers, as we saw in China, but data is becoming important in the consciousness of the professionals, at least. And this is what allows people like Marius to start working with models and be developing models that are there to do good, you know, and so this is one good aspect. And the other thing I saw is also in the consciousness of the public. You know, when I see everywhere in social media, people talking about flattening the curve, well, that curve is based on some statistical models behind it. Sure, it's not machine learning, but people are talking more, taking in the data and actually acting upon it, which is the next level where I think we can reach once digital transformation is more perhaps completely globally for healthcare. For me, first step is being able to predict individual patient trajectories, and then start investigating the data, possibly through methods of interpretability, to start asking the whys because a trajectory, a health trajectory, and then start asking how can we best intervene. So for me, with all this, it's tragic, really. You see all this unnecessary, or you know, stochastic deaths, if you want. You know, this is very unfortunate living in 21st century. At the same time, we are in 21st century, and I see more prevalence of data-centric approaches. I see people are interested, are asking me about what is happening, how can things be better with data. So I think this is a positive that could come out of this tragedy.
David, you've been working with laying out strategy for before joining H2O at Utah and University of Utah, MGH. What do multi-hospital how do they deal with this problem? I mean, we have a customer who's in the same spot with multiple different units in a single city geosystem. What are some of the things that strategists right now should at these hospitals? Tell me what are they thinking?
Well, I would say in general, the most successful approaches, the most successful implementations of healthcare efforts, right, are based on team effort, right? And so, you know, I think, you know, in any hospital system, for example, you're going to have individuals with varying levels of expertise, and then in addition to that, right, you have individuals outside of kind of the outside of medical practitioners who bring certain skill sets to the table. And so in the efforts that I've been involved in, you know, in implementing healthcare initiatives, right, you bring a number of different individuals and teams to the table, right? So you'll have your medical practitioner, you have your data scientists, you have your data engineers, right? And I think that's something that needs to be done. Sometimes it's tempting, you know, especially on the data science side of things, right? There's a lot of publicly available data that's out there, and you think, you know, I'm going to do something with this data, or I'm going to go download this data and I'm going to do something with it. But without coordination, without cohesive effort, without working with with others within the healthcare industry, without coordinated efforts with healthcare institutions, your efforts are going to be, or at least the results of your efforts are going to be minimal. And so I think that's just one of the key components here, is making it a team effort.
Well, we've actually spoken about team sports all the time in our lives, and H2O is nothing but a team sport where health, finance, insurance, the domain knowledge is kind of where the last mile of bringing that to the fore is. Marius, in terms of bringing data to the fore, what were unique challenges, right? Sort of, how do we narrow that gap between domain scientists and data scientists to produce something that is compelling for decision makers to make a case for change?
Yeah, you obviously need both. I think we have a lot of folks that they have raw data science skills that can be applied to any domain, but being able to incorporate domain knowledge, I think, is also very important, because epidemiology has its own parameters, its own models that can be applied, and you can do a lot of research obviously alone, but you rely on your colleagues and the experts in the field in order to put you into the right direction. I think then you can incorporate that domain knowledge into, for example, in this case, very data science or very machine learning driven application. An example will be this SAIR model. It's not something that I had familiarity before they started. It's something that I figured out because my colleagues that have worked in this space, they mention it, and we put it into a machine learning application of trying different parameters, essentially drawing different lines and try to make a very good fit for this type of problem. And I think this is where it's really important to be able to bring like the two together in order to be able to get the best result.
So tell me, what kind of models did you end up using here? Did you use its time series, which is a tier problem for us? But
I've tried multiple approaches. I've tried standard ARIMA approaches because I was very familiar with in standard time series problems. I've tried exponential smoothing or linear models with a lot of many autoregressive features. We have applied some epidemiology specific models like the SEER and SAIR model. In this specific application you see right now is an automated ARIMA approach. We've built other models with our automated machine learning toolkit, which is able to try many of the things I've mentioned before and try and find good fit as well as a good ensemble of them to be able to give you better predictions for different time spans. The one you see now is actually a product of AutoArima.
Great. In terms of there's a lot of short-term application of data that's going in right now, but if you zoom back and look at long-term ways of delivering care where it's needed, a lot of change has come in the last couple of weeks. Even it feels like a decade of change in healthcare. What are some of those initiatives, David or Niki, that would have big impact in how technology can come to the fore? I will start with the first one that happened yesterday. New York City finally made anyone who has early graduated the class from New York University, the class of medical students, and that was a incredible. So 3 months ahead of time, they could go in and start practicing and helping. I think they also made anyone with any medical degree world over be able to practice during this time of pandemic. As you can see, as represented by the folks on this panel, most of us are engineers, scientists, and data people, physicists. We grew up in other parts of the world. We came here and transformed technology, and I think there's a dearth of talent infusion that hasn't happened in that space. So the equivalent of bringing immigrants to come change this planet, change this country, needs to happen in healthcare, and that has happened yesterday. So I was quite excited about that change. But Niki and David, could you touch as well as Marius?
Sri, I will largely agree with you in the way, the big picture you just described. For me, it's what the next day, what the best gift we would have after this whole tragedy is how we all come together globally. I feel global organizations have played a prominent role in coordinating the efforts in many, many cases in many countries. I'm not from the States, I'm originally from Greece, and I have lived across Europe for many years. So I talk daily with my friends across Europe, and I see we're all in the same boat. This is something that I think we should carry with us after this crisis. And of course, I am very optimistic moving forward on the fact that, as I mentioned earlier, people, not the data scientists, not the experts, but people start to have a good consciousness of how important it is to also trust data and to rely on data for our next moves.
Thanks, Niki. Ian, can I share my screen?
As David is figuring that out. Yes, go ahead, David.
All right. So I think, you asked, where are some opportunities? And, I think, and this relates to what we're experiencing with COVID-19, but I think it's obvious, most of us know that healthcare spend is increasing over time. And, you can argue whether we're seeing an increased benefit from that increased spend over time. But what's interesting about that is spend over time is it's concentrated in a very small number of individuals, right? So, less than 5% of individuals, and this is consistent across all healthcare institutions, fewer than 5% of individuals account for more than 50% of the spend, right? And whether you want to talk about spend or whether you want to talk about medical outcomes, I think, we're talking about the same sort of thing, that there are a small number of individuals who are accounting for a large degree of medical care and medical spend. And a lot of that is just due to, a lot of that could be resolved through better patient management. And I mean, when we're talking about COVID-19, I think we're seeing that as well, right? A high number of the deaths are coming from people with large numbers of pre-existing chronic conditions, right? Whether it's diabetes, whether it's COPD. And so I think for a challenge for a lot of healthcare institutions is identify who these individuals will be going forward, right? So can we use historical data to identify the predictors of these individuals? And again, this is, regardless of what aspect of the healthcare system you're talking about, whether it's in general, just inpatient admissions, whether it's talking about ER admissions, these same patterns exist across all these different facets of the healthcare system. So I think one key aspect of using data is, healthcare data is extremely rich, and healthcare institutions actually sit on a lot of really rich data. And being able to use that data to identify who these individuals are and to design and develop interventions built around those individuals. I think this is a huge area for the use of data in healthcare institutions going forward.
It's amazing.
Something to add on this point, or maybe later.
No, isn't it a surprise to have two? Probably it's not surprising to have two Greeks on this panel. So Marius, Tell me how, and you're speaking from London, and have been on the forefront of our COVID-19 response, along with an incredible team behind, with several of the folks within the company on that train. Tell me what you've kind of been picking up over the last few weeks here, but also in the general scheme of things, how we can use the problem as an opportunity to transform.
Yeah, I think something that was, I'm not saying it's, you can say it's good, maybe it's not a good term given the severity, but because data becomes accessible in different forms to people, you can do more things, and you can start with simple things like predicting number of infected cases or disease. These are data that have become available, but also over time you are and while initially the impact of different strategies, for example, that governments took is not very clear, over time we'll be able to understand that this country, this state applied this type of measures, and it had this impact. While it's ongoing, it's not very clear, and as you know, UK has taken a very different strategy than other countries, and I would be hesitant to comment because I don't know how it's going to pan out. For some of these things, you might need to wait a little bit in order to fully understand what was the most successful or not in the short term or in the long term. But I see there is a lot of opportunity here because this process has been so well or better documented than others, and with a lot more data sources available to and extended to more people to be able to get insights and understandings about these things, so that next time we are much more prepared and careful, we can transform this into products that can prepare you in advance, tell you which one is the most successful strategy when you need to act.
I think one of the things H2O is fortunate is we have a global audience, right? So that we've managed to, our H2O data science communities are global. We have had, even in the early days of Wuhan, during in the January timeframe, as they were going into the holiday season, we were called into action and started looking at some of these conversations in China. And so one of the most interesting one that I'll pull up in a short order is how they used WeChat and Alipay transactions to overlay and try to trace the contacts who might have touched or who might have come in touch with both from the seafood stall where it started or around that area where it started, all the way to every city. They've managed to get a score for everyone who might have been in touch with the virus, and so as a result managed to quickly quarantine individually and reduce side effects. So technology and data have never been this forefront. There are other interesting themes, and to your point, the head of the Chinese response, his comment was, it's yet to be seen whether a serious lockdown immediately or a long-term play of herd immunity. All of them are different, very extreme opposites of intervention. And I think social distancing is what we have seen work. And so we definitely want to continue to put that in the fore. California, H2O itself has distanced in the earliest days, but in general, California has done a remarkably impressive fight back in changing the statistics for the whole country here. But what are some of your favorite dashboards? A lot of our audience are hungry for data. They're constantly seeking replenishing data on Twitter, on feeds. What are some of your favorite dashboards, and if you could share them?
Sure. Maybe I can show you mine. So,
of course, we know your favorite one is Q State, but
Yeah, I mean,
Other than
our favorite are the ones we've built internally, but this is one I really like, Worldometer. It gives you some basic numbers very quickly, and I think it uses different source than many other dashboards, so it's kind of more reliable. It's less prone to not working, so I like this one. Another good one is actually this YouTube channel that plays this COVID-19 dashboard live, and it has some music as well, a bit dramatic though. So these are two that I like. It's quick. There are some others which are a bit more interactive, but these are the two ones that I look at because they tell me the information I want to know quickly.
Niki.
Yeah, actually, yeah, if I can switch. Okay, can you see my screen? I do like the John Hopkins dashboard. This is actually the data that Marios mentioned earlier. He's also using for the Q app he's developing. So what I like is, first of all, they have multiplicity of data sources, as well as they allow you to actually break down to different administrative levels, from whole countries to provinces or even down to cities. And then they have links to a lot of useful information, and you can zoom in and out. You can check active cases or cumulative cases, and I feel it's get updated every 1 hour roughly. So this is a trustworthy source for me that I can get updates at a glance.
David.
Sure, I have several. Let's see here.
I like that. Several is a good answer. More like rest of us.
All right, so obviously, Niki pointed out the Johns Hopkins. I think this is one of the more well-known ones. Let me just point out a couple others. So this one is from University of Washington, and as a previous developer of dashboards, I really have an affinity for dashboards that I can drill down into. So, for example, here for North America, for the Western region, I can drill down into that and see what's going on. I can drill down into other areas here and see what's happening in each of these communities. And as I drill down on them, right, I can it'll update over on the left here what's happening in that particular area. So that's, and then just visually, I find it very appealing as well. They've really done a nice job on this one. A couple others. So this one is a very simple dashboard, but it gives you a real good sense immediately how countries are doing in comparison to each other. So a lot of the dashboards will show, these big bubbles. The Johns Hopkins one shows you big bubbles, but you don't get a sense of, well, how are the different countries doing in terms of bending the curve, or and we can see, and in terms of their intervention policies, how well are some countries doing in comparison to others. So you can see here, and they've got these nice metrics here that you can see how fast the case counts are increasing every day. So Japan's doing very well, and part of that, and again, I realize with some of these there might be an issue with data, and with Japan there might be an issue with data reporting there or with testing. All of this are reliant upon testing results. But you do get a sense.
There's no problem with testing in the U.S., right?
That's right. That's right. But you do get a sense for a lot of these countries, how well they're doing, and you can see where the United States is here and how their case count is progressing, and then you can play this over time and see kind of how what's been progressing over time, and how the different countries have progressed in terms of their case counts. The final thing I want to point out here, and this is not a dashboard, but I think one important part in any healthcare, evaluating any sort of healthcare situation, right, such as COVID-19, is storytelling. And right, so sometimes with dashboards, you can play around with a dashboard, but it's a little bit hard to identify. So what's the real story here? Right? And I think storytelling is extremely important in healthcare. And right now, Financial Times, a lot of their content is behind a paywall, but this coverage is free right here. And I think this group here, this is daily updated, and I think they're just doing a fantastic job here in storytelling and piecing together all these disparate components of COVID-19. Whether it's cases, whether it's deaths, how countries are comparing to each other in terms of bending the curve, what it looks like globally. And then on top of that, they'll go into some economic indicators, right? Because obviously that's, it's not just the stock market that we're concerned about, right? It's not just people's 401k, it's people's livelihood, right? Unemployment, how is that being affected? How many people are going to be negatively impacted by what's going on right now? And so I think what they're doing here at Financial Times is really great in terms of storytelling.
I think telling the story is 90% of the work, and I think clearly, I mean, some of the platforms you're building are certainly trying to do the same. I was going to share one screen as well. Of course, our heart goes out to the front line. One of the things that many of you might have seen, the social distancing, definitely the lack of PPE for healthcare workers means we need to really help them through proper distancing, social distancing. Certainly, some of my favorite topics. But I would say I would say one of my favorite ones, recent favorite ones, is Enco.ai, produced by one of our own H2O team member. I don't even know many of H2O folks know about it. It just runs through the entire gamut of, in a TV-like fashion, runs to the gamut of all the top 10 dashboards out there. And then one of the important one it has is the 10 1-acres 30, which is also another favorite of mine. Again, a lot of rich dashboards out there. Data science has never been so forefront of telling how things are emerging and how to adapt in this world. And I think we're certainly fortunate as data scientists to be in this space where we could make a difference in uncovering important answers to questions. How long should the distancing be? Should we open these offices or not? AI and data science is coming to the fore to help, but I think our understanding of the space. But in the end, we are probably coming back to the same question again. How do we relate to ourselves as humans in this world? And I think science and intelligence have played a very strong role in our view of our relevance in this world. For a long time, we were in the top of the pyramid. And as a child, when I was reading the food chain, I was shocked that my biology teacher put the RNA virus just as high as the top predator on the planet. And I think it's come every 100 years, we get to see it. Lots of people are in the forefronts of fighting this. And as humans, it's a one-of-a-kind opportunity to come together. And my rallying call to the audience is that several of the folks in the audience are dealing with this, both psychologically as well as physically and scientifically, with your fullest attention and hearts and minds. And I think we would love to rallying call for the audience and the community is to come together. We're gonna please self-select yourself. Would love to have webinar/meetup like series where you can talk about your stories, your dashboards, your favorite data presentations, as well as your local community work. One interesting, we have a team in Prague, Czech Republic, and one of the interesting story we heard yesterday, how the community got together, sat down for 10 days and produced face masks for the entire country. Things like that, stories like that are inspiring stories of phenomenal and heartbreaking heroism that have emerged from China, that are emerging from Italy, emerging from New York and Iran. I think we want the pandemic has an opportunity to transform heroes out of everyone, and kindness at this time is kind of the that rare phenomenon, and it's at once humbling to see us to see the edge of science and the edge of what we could do as societies. And I think our plurality as a civilization is going to be our strength, and we'll overcome COVID, and we would love to seek out the audience and the strength that is needed at this time. Ian.
Awesome. Well, thank you everybody for joining. And we'll go to the questions. So Shri, do you want to go to we had a few pre-asked questions, and we have a bunch of questions in the questions window. Let's go through them. Give me 1 second. There's a lot of questions about the dashboards and the links to your favorite dashboards, so we'll send those after the webinar is over. Let me just go through them real fast.
Actually, can I point out another source of information, and we'll post this as well. Can I share my screen here again?
Sure. Give me 1 second.
So one other source, for those interested in contributing to the effort. So this was just Marios and I put this together, and this was just posted this morning. This is out on our blog. But we outlined here a couple of, for those interested in kind of joining the effort. And again, I mentioned earlier that I think all of our efforts should be coordinated, right? It's not very helpful for each one of us, especially now that everyone's working from home. Just to be in our own cubicle working alone. But there are a number of coordinated efforts out there where you can join in and contribute to this effort, whether it's a data science competition, whether it's a groups that are seeking expertise or just general assistance, or even just contributing computing power. So this is and again, we outlined here some of the data sources we've used for the app that's been developed on our end, and we point out some of the other efforts that are going on here. So if you're looking for additional resources or looking for areas to help, this is one place where you can go and look.
Awesome.
And we'll post that link as well.
There are Kaggle contests, and actually I was talking late last night to another Kaggle-like environment for public good from Africa, Zindi. Then SRK has been doing a lot of Kaggle data sets competitions from H2O India. Clearly, I think H2O is very open to creating an open space for sharing, a Zoom room where we can create the control room for data analytics. We started working with Berkeley 2 days ago, and they asked us, they had the same question, several researchers trying to solve the same problems. Some startups that are working on inexpensive ventilators have reached out to us for access to reach out to MDs. Our unique position at this point being open source, community focused startup with a lot of ethos on this. H2O, we tried to stop our sales kickoffs in January as a reaction to what was happening in China. So we've been very much trying to safeguard our own people, but our people include the community of data scientists we serve and the customers we serve. It's a privilege to be here at this time, to be of service to the world. And I think we are at once humbled by the opportunity at hand to be of relevance to the world and across borders. And I think any problem that you think you can join and help us, we'll probably put together a simple Kaggle-like environment where you can jump in and start helping. Our goal is to give you just as much meaning as it is giving to us as we are doing the science. It is one of it's a tragic moment for the world. Several of us, many of us, underestimated the problem, and I think, but nevertheless, I think the combined spirit and aptitude of the and humanness of us will shine through, and we should be able to overcome from here.
I think we can address a few more questions, Shri. One was, how can ML concretely reduce a vaccine time to market?
It's a good one, actually. Clinical trial matching has been a problem we've been asked to look at, and as well as drug discovery or reuse of drugs. A lot of discussions around bringing back some old drugs as well as new ones. I think a lot of both for treatment, but also as Kaiser permanently enrolled their Washington hospital vaccine. Roche and others have been racing. Gilead is also one of our user communities. But I think in general, I think the ability to shorten the length of the trials, and it's a time of real pandemic, so a lot of folks are beginning to kind of unlock traditional regulation here. But it seems like real vaccine is still out of 2020 anyway. It's not within the reach. But Niki.
Yeah, thank you, Sri. If I can very quickly add on a different aspect of the vaccine development, which is the preclinical trials aspect, where here, as the World Health Organization announced a few days ago, if I'm not mistaken, the preclinical trials period for this vaccine, which is now, as you mentioned, steadily starting progressing towards that stage, took 60 days. This is already a triumph of molecular biology, historical knowledge, as well as the usage of data to reach there in 60 days. Imagine, we only have vaccines for a little more than 100 years, and now we're in a stage that, given the information we have, in 60 days we can move to clinical trials, and then of course Sri, all the issues you mentioned there do apply, and it would be ideal if we could cut those times short too.
Yeah, some of it is regulatory, but I think in general, flu has been escaping our combined intelligence for decades, if not a century. So I think it's about time to bring the world's top data scientists and health scientists and medical innovation to bear. One of the things that is actually happening is 80% of the people are not being affected by the flu. So I think we'll see potentially reuse of people who are immune or have become immune because of having recovered to come to bear. I think there's a lot of discussion on how to reuse just the human capacity of having overcome the disease in the last 4 or 5 months.
Here's another question that came up a couple times. How can we improve the simulation to predict the spread of the virus?
If I can quickly offer an answer from the biology, and then you can go from a more practical way. You have worked with data. From a virus perspective, we need to understand better the factors that affect its spread. So these factors can be anything from pollution to carriers, to presence of carriers, how long the virus can withstand in air. These data have already crept into the news. So we need to have more systematic, better understanding, first of all, of the virus and its transmission mode better. And please, Marius.
I mean, something I think that was very spot on. Something to add is that I think in the simulation there are some sources of data which you will know, and you can rely more. You can rely more to it, but there will be the sources that you don't know, which are and you will have to make assumptions. How good the assumptions will be, how informative, how to constrain them as best as you can in order to be able to give a more reliable forecast about how things are going to pan out is, I think it's very important.
Well, and just on that note as well. Oh, sorry. Go ahead.
No. I'm basically done, so you go ahead.
Yeah, just on that note, right, there are going to be sources of uncertainty in any sort of simulation, right? And I think modeling that uncertainty is important, right? Instead of just, when you're certain of a given factor, right, instead of just plugging in your best guess, right, running multiple simulations with a range of values, right, and being able to then model that uncertainty and not just getting one set of results for a given set of factors.
And then obviously extensive validation. I mean, as soon as data become available, you need to be able to go back and see how you could have done this better, how learn, make the simulation become better itself.
And of course, here, let me just reiterate the importance of collaborating and having domain expertise, because exactly what you mentioned, Marius, can be better and faster achieved if you have an idea of pre-existing research and causal relationships.
Yeah. Well, I think also backtesting, right? Sort of, you should probably be able to now backtest the results from this is a fast emerging space, right? So, so you can go back and see what parameter in simulation could have changed to now fit each of these predictions. Actually, the role of AutoML, we have not talked much about it. Arno and team have improved the times for the Kaggle Grandmaster, have improved the time series to a point where driverless AI is now able to fit to these predictions nearly accurately. There's also simple methods. Leland Wilkinson is also partnering on this with us, has put together a Poisson distribution that shows the death rates from Italy very clearly, very accurately almost, unfortunately. They're simple methods, they're sophisticated methods, but I think eventually the data teamwork, right, sort of ability to bring data scientists and domain scientists very closely in our hospitals, and then looking at the feedback loop from the global environment, that will make a big difference in these. Also, call out for Shivam, who's been working on this project with Marius. Marius, do you want to just mention the rest of the team? A good chunk of H2O is there are two very popular Slack channels as well. We are considering opening one of them to the public so that folks from the webinar can join that and be part of fast simulations. The time it took to build that Q app was less than, I gave Marius less than 24 hours in the first iteration of it. And then it continued to improve almost on a daily basis. So we'd love to kind of put that up so folks can jump in and add more panels, add more dashboards to it.
Yeah, and big thanks to our team. As you mentioned, Shivam, Sai, Lena, everyone on this panel, our team who works with the AutoML product, Arno, our CTO, Faron, as you mentioned, tremendous work adding components that are specifically applicable to the current situation we're facing, really addressing the needs for modeling for this type of problems.
Final minutes of the webinar. Ian, I want to convey the same, our deep felt thoughts to my favorite city, New York City. I know Niki, you're dialing in from there. Michael Proksch is also one of our New York contributors, Guangxu Zhu from New Jersey. We have Kerry O'Shea, or New York folks in New York, both from H2O people, community members, data scientists, customers. We are here because of you, and we are really excited to be. We are with you in this fight, and we'll leave no stone unturned to definitely put our best people behind the problem. So we look forward. I think Ian will probably announce the upcoming one of this. We'll try to bring some even more domain experts from the hospitals, MDs from ER. H2O has been historically used to triage. 160 hospitals have been using H2O to triage accurately, and I think we are in a crisis mode in some cities, and in some cities we have the avenues and resources to be more able to help the other cities. I think this is the time of self-trust, but also self-introspection on how who we are as a species, and how to kind of combat something that is going to challenge our established thinking into building bridges and helping our neighbors, helping our children. I know a lot of you are adapting to working from home. 2/3 of the globe is at home right now, bringing back the values with which we were raised about 100 years ago. And I think learning how to kind of be there with your children and families at this time is just as much fulfilling as being there for the rest of the world. So thank you. Thanks, you.
Thank you, everybody, for joining.
Thanks, Niki. Thanks, David.
Thank you.
Thanks, Mario.
Bye.
Thanks, everyone. Cheers.